Hi, my name is Kevin and I'm the host of the Treasure Coast Business Spotlight, brought to you by Fiorillo Insurance. And I'm excited to be on location at Palm City Eye Care with Dr. Jason Davis, who is going to be sharing with us some tips about making sure our eyes stay healthy. Because as they say, a picture is worth 1,000 words. So if a picture is 1,000 words, think about all that information going into your eyes and how valuable it is, and think about all the memories you have, and it all comes down to what you see. So, Dr. Davis, thank you for taking the time to share with the viewers of the Treasure Coast Business Spotlight. Now, you probably see quite a few eyes.
I do.
Yes.
Lots of eyeballs.
Lots of eyeballs, I'm sure. So what are some of the things that you see that keeps eyes healthy?
Some of the things that keeps eyes healthy, really down in South Florida, the best thing you can do is wear your sunglasses.
Okay.
UV damage is something that affects everyone. It's pretty much the same kind of effect as skin cancer.
Okay.
You do a lot of damage in your 20s and 30s that you pay for in your 60s and 70s.
Ah, gotcha.
So the more you can protect your eyes now, the less risk of macular degeneration you can have in the future. Macular degeneration is a disease that affects your central vision, causes the central vision to become really blurry.
Okay.
To where everything you stare at is a big haze. Your peripheral vision's still there, but it drives people nuts because you can't read, can't look at street signs. And so that's something we really want to prevent as a younger person.
Okay, so as someone's younger, making sure they wear sunglasses and stuff like that, then let's say in their 20s and 30s, they're wearing sunglasses, but what if someone is now in their 40s and 50s and they didn't wear sunglasses quite as much? Is it ever too late to start wearing sunglasses?
It's not. It's definitely something that it kind of compounds on itself. So
okay.
Obviously you do a little damage in your younger age, but you can still save your eyes from quite a bit of damage wearing your sunglasses as much as possible.
Okay. So are there any particular type of sunglasses that might be better than others?
Getting a good polarized pair is really important. Everyone wants to buy the $5 one at Walmart.
Right.
It might look good, but if it's not polarized, it's really not helping that much. You don't have to go out and spend $200 on a pair of sunglasses, but at least get a nice quality polarized pair. Okay,
so polarized sunglasses will help, with the UV rays and whatnot. Okay. Now, behind me, we've got your examination equipment. So I'm sure everyone that's been in a chair like this has seen the, what's better, A or B or whatever the case is. What else are you looking at when you're looking at someone's eyes?
So obviously this is the phoropter. This is where we're checking their prescription to check for glasses and contacts.
Okay.
That's very important. This is more important. This is the slit lamp. This is basically a microscope. Helps us look at the health of the eye. With this, we can look in the back, we can look in the front, we can look for cancers in the back of the eye, we can look for diabetes, we can look for blinding corneal diseases.
Okay.
So this is the better one or two machine, as people
say,
which is very important. But this baby here is kind of the bread and butter.
Okay. So you're able to look into their eyes and see all kinds of potential diseases and whatnot.
Exactly. So a lot of people don't know that in the back of the eye, it's the only place we can study blood vessels without doing a bunch of invasive procedures.
Oh, okay.
So high blood pressure, diabetes, leukemia, sickle cell, cholesterol, all these different things can be seen by just looking in the back of the eye.
Oh, wow. So it's some things that maybe they wouldn't catch otherwise, or even at their doctor's, their primary care physician may not catch it either.
Exactly. We have kind of a unique situation in eye care where we get a lot of stubborn people who haven't been to any doctor in 15 years because they don't like to go to the doctor, but they have to see. Right. So we'll see, just for an example, we'll get a 55-year-old gentleman that walks in, may have a bit of a beer gut, hasn't been to the doctor in 15 years because he doesn't like the doctor. Right. But now he can't read up close. And now he can't see his phone, he can't read his books, so he bites the bullet and comes to us. Well, we do his exam and we get him to 20/20, but then we dilate his eyes or we take a retinal photo and we end up catching diabetes. Or he is told for the first time that he has heart disease or high blood pressure. So it's a really important way for us to kind of screen patients that otherwise might not go to the doctor. Oh, wow. So you're catching a lot of things early on. Okay.
What are some things that people could do in between other than, wearing glasses? Are there any things they could do like to maybe be on the lookout for, something that's irregular in their vision or something like that in between screenings?
Absolutely. So one big thing everyone can do every day, it's super simple, but just cover each eye. You'd be surprised how many people, when I hand them the paddle in the exam room and I say, hey, cover your left eye, and they go, can't see out of that eye. Because with both eyes open, they don't notice. And if you can just give yourself a quick check, especially elderly people, you can get a stroke in your eye. You can have, a retinal detachment and not know it. Because some people will have great 20/20 central vision, but they'll say, I can't see this sector over here. And if it's something that just with both eyes open, your other eye can catch it, so it doesn't bother with it.
Okay.
Other things they can do is a little bit of artificial tears. A lot of these ocular surface diseases can really be, managed easily just with keeping the eye lubricated. Sustain, Refresh, Blink, all decent brands that you just throw a couple drops in throughout the day and keep your ocular surface hydrated. Kind of keeps away some of the bad things.
Okay. Good deal. Now, you mentioned elderly people. We've talked about people in their 40s and 50s and in their 20s and 30s. When is the good time for parents to start getting their kids checked out?
So ideally, the very first time you bring your child in is about 1 year old.
Okay.
I know it's not very common. Most parents don't think about that. And at 1 year old, we're not asking them better 1 or 2.
Right.
But we're making sure one eye isn't +6 and one eye is perfect. Or there's a tumor in the back of the eye. Because if you wait till your kid is 5 or 6 years old and there's a retinal blastoma growing, it's going to be huge and blinding if you wait till then. Okay. Usually, you see maybe on Facebook the pictures where they take a picture with a flash and one child's eye is red, one child's eye is white. And they say, what's wrong with that? This picture saved my child's vision. That's what a retinal blastoma is, where there's a white tumor in the back of the eye that sometimes with the flash of a camera can be caught. Okay. And so that's why we want to see them at 1, just to make sure there's nothing bad in the back and that they don't have, some crazy high prescription that we need to put them in glasses right away. Okay. So it's one of those things, you'd probably take your car in to get an oil change, so. Exactly. And probably even more important to take your kids to have their eyes checked. And most people have their kids on their insurance and they just don't have an eye exam until they're 5 or 6, so that's 5 years that they could have been taking them in and having their insurance cover the exam. Got it. So it's not a big expense, and it's just one less worry you can check off your list. You may have seen those other videos on Facebook where they put the little, rubbery glasses on the toddlers for the first time, and they see mommy. Oh, yes. And so that's what that catches is, little Timmy's +5 in both eyes. We really need to put him in glasses now. Or if we wait till he's 6 or 7, he's going to be pretty blurry their whole life. Got it. Okay. Well, this has all been very helpful. So, really appreciate you taking the time to share these tips to help us keep good, healthy eyesight. So, thank you. If you're in the market for glasses, or you realize, it is time to just have my eyes checked out, I definitely would recommend checking out Dr. Davis. I personally visited Dr. Davis. He's done a good job, and he's actually, if I read correctly, you grew up here in Martin County? I did. I grew up right here in Palm City. Palm City Elementary, Hidden Oaks, Martin County High School. I couldn't get back here fast enough. I love it here. Well, good deal. He's very active in the community as well. So thank you so much for watching the Treasure Coast Business Spotlight, brought to you by Retinal Insurance. And have a great day. Appreciate it.